Sometime in December of 2019 or early January of 2020, a new severe pneumonia started to appear in Hubei province in China, especially in a city called Wuhan. By now, you've probably heard about the novel coronavirus that has, at this telling, February 18th, 2020, infected more than 75,000 people and killed more than 2,000 people. It's very confusing to understand exactly what this virus is, what it means, and what one can do to protect oneself, because a lot of the information is spread out in very many different places, and it's often described in very scientific language, which is hard to understand. In this video, I'm going to try to give you about 15 facts about the coronavirus in plain language. Hi, everybody. I'm Bruce Lambert from How Communication Works. This is a channel where I teach you about communication skills so you can improve your relationships, succeed at work, be more confident, and lead a more fulfilling life. But I'm also a professor of health communication at Northwestern University, and in this video today, I want to talk about a health topic that very many people are talking about right now, the 2019 novel coronavirus. There's lots of information available on the web and on television and elsewhere about the coronavirus for people who are curious, but I was surprised to find people in my everyday life who didn't know very much about it, and so I thought I would try to make a video explaining some of the basic facts as I understand them now. Now, why should you believe me? Am I a doctor? Well, I'm a PhD kind of a doctor. I'm not an MD kind of a doctor, so maybe you should take what I say with a grain of salt. But I am a scientifically literate person. I have more than 100 peer-reviewed publications and have had millions of dollars in scientific grants from the US government. And I worked at the University of Illinois College of Pharmacy for many years, and I've been doing health-related research and published papers in journals like the Journal of the American Medical Association before. So I'm a scientifically literate person, though I'm not a medical doctor, and so if you want to take that into account or go watch another video, you can do that now. But I think that I can explain some of these facts about the coronavirus in plain language. If you're someone who knows a lot about viruses or who's a medical doctor or a pharmacist or a nurse and you want to correct something I've said, please feel free to do so down in the comments. So I've got about 14 or 15 basic facts which I think are important to understand in terms of what the coronavirus is and what we should do about it and how afraid we should be and so on. Fact number one, the coronavirus is a virus. So what's a virus? A virus, there's a debate as to whether a virus is even a living thing. It's different from bacteria, which are living things. But a virus is just strands of genetic material wrapped in a kind of protein shell and maybe a fatty shell outside of that. And viruses bore into your cells and then take over the genetic machinery of your cells in order to replicate themselves and do damage to your body. So a virus needs a host to survive, and the coronavirus is a virus. There are thousands of known viruses known to science. All of them are harmful. There are good and bad bacteria, but viruses, as far as we know, are all harmful. And this one, the coronavirus, is in fact also harmful. But the most important thing to understand about the coronavirus being a virus and not bacteria is that antibiotics are useless against viruses. So antibiotics are useless against the coronavirus. Antiviral drugs exist and vaccines exist for viral illnesses, but antibiotics don't work. Now, it is true that some patients with severe cases of pneumonia due to coronavirus infection do get antibiotics, but they get those in order to prevent bacterial pneumonia from coming in and attacking on top of the viral pneumonia that the coronavirus causes. So, number one, coronaviruses are viruses. Antibiotics don't work against viruses. Fact number two, the coronavirus is new. That's why the World Health Organization calls it novel coronavirus 2019. It seemed to emerge in November or December of 2019. It seems, based on its genetic blueprint, which was quickly identified and published on the web by Chinese scientists after it emerged, based on its genetic blueprint, it seems to be related to other coronaviruses, which occur in bats, and especially in these scaled mammals called pangolins. So this virus appeared to originate in non-human animals and then jumped to humans, like bird flu has in the past, like swine flu has in the past. This virus jumped from either pangolins or bats to humans, probably in the context of one of these wet animal markets in Wuhan, China. And that's how it got into human beings. So it's new. One of the most important parts about it being new is that we have little or no immunity to this virus, both as a population and as individuals, because it's new and our bodies haven't experienced before, and we haven't produced antibodies that can fight against it. So our immune system is taken by surprise by this new virus. There are lots of other coronaviruses. In fact, there are 4 or so coronaviruses that cause the common cold. So not all coronaviruses are deadly. Coronaviruses are well understood. They're called coronaviruses. Corona means crown in Latin, I suppose. And so there's, if you look under a microscope at the structure of the coronavirus, it has this little hoop or crown on top of it. So this family of viruses are called coronaviruses. But there are others. But most importantly, not just the coronaviruses that cause the common cold, but there are 2 other coronaviruses which cause severe and often fatal pneumonia. One was SARS, if you're old enough to remember the SARS epidemic, SARS, SARS, severe acute respiratory syndrome from 2003. SARS infected about 8,000 people and killed about 10% of the people that infected before it was brought under control by effective infection control measures. But it was very frightening in 2003. So that was caused by a coronavirus. And there's another disease called MERS, M-E-R-S, Middle East Respiratory Virus, which also causes this acute respiratory distress syndrome, a very serious viral pneumonia, which is often fatal. So SARS and MERS are also caused by coronaviruses. SARS, I think, also came from bats. MERS came from camels, I believe. And it kills people in the Middle East. That's why it's called Middle East Respiratory Syndrome. So we have some familiarity with viruses like the novel coronavirus. The fatality rate for SARS was about 10%. The fatality rate for Middle East Respiratory Syndrome was about 35%. These coronaviruses, which cause very severe and frequently fatal pneumonias, are not completely unfamiliar to science. And people started to develop vaccines and drugs for these before they were brought under control, which will give us some hope, and I'll get to later. 4, because it's early in the epidemic, most of the estimates about how contagious the virus is and how deadly the virus is, there's a tremendous amount of uncertainty around these estimates. So you'll hear lots of estimates about the fatality rate, anywhere between about 1% to about 15%, with most of the estimates hovering around 2%. And the sort of main data that are coming out of China, roughly like 2,000 fatalities out of 70,000 or 75,000 cases, you're getting this estimate of about 2% of the infected people die. But there's tremendous uncertainty around these estimates. And I want to talk about some of the reasons for that uncertainty. So the first reason for the uncertainty is the potential unreliability of the data coming out of China, where the epidemic is the worst. So the vast majority of cases of this COVID-19, that's the name of the disease that coronavirus causes, coronavirus from 2019, COVID-19, the vast majority of cases are in China. And China, especially during the SARS epidemic in 2003, was not transparent about the size and scope and severity of the epidemic. So some people still distrust the information coming from official sources in China about the number of infected people and the number of fatalities. So one reason for the uncertainty around these estimates is the potential unreliability of official data coming from China. And it's not only because in China they may be censoring the data. It's also because the Chinese health professionals and epidemiologists are overwhelmed by the sheer number and severity of cases that they're dealing with. And that may also cause some unreliability in the numbers, having nothing to do with intentional censorship. A second source of uncertainty has to do with time. There's a time lag between when you get infected, when you show symptoms, when you seek care, and then when you ultimately die. So until all of that shakes out, especially until all the people who are infected die. What if it takes 3, 4, 5, 6 weeks between the time you get infected and the time you die? That means people who get infected today won't die until 6 weeks from now, and we won't be able to add their deaths to the numerator for the case fatality rate until 6 weeks from now. So generally the observation is the case fatality rate actually increases as the length of the epidemic goes on. And it's not that the underlying fatality rate increases, it's that our understanding of the actual case fatality rate gets more accurate, and that grows as time elapses and the cases that were infected early have a chance to go through their whole kind of disease trajectory, and some of those patients die. So that's another source of uncertainty, is this time lag. A third important source of uncertainty is the number of mild or asymptomatic cases. It's likely that there are many cases that are mild or even have no symptoms. These cases are probably not being counted because the doctors and epidemiologists are so busy taking care of the severely ill symptomatic patients that no one is counting the mild or even asymptomatic cases. The only way to count those cases accurately is to actually do population surveys and take blood from a representative sample of the population and see how many of them in their blood show antibodies against the virus or evidence of the infection. Now, we do that under normal circumstances in the United States and elsewhere against the flu, for example, to find out how many people actually were exposed to the flu virus. Then we can see how many of them got sick, how many of them went to the hospital, how many of them died. But right now, mild and asymptomatic cases are probably not being counted at all, and there's no population surveys of people who have been infected. So that adds to the uncertainty. But I should note also that this probably means that the observed case fatality rate is probably lower than we think, because many of the mild cases are not being counted in the denominator. So when China says there are 75,000 confirmed cases of coronavirus, that doesn't include maybe tens of thousands, maybe hundreds of thousands of non-confirmed mild or asymptomatic cases which aren't being counted. Fact number 5, how serious is it? Well, it's hard to know for all the reasons that I just described, so that's why I talked about uncertainty first. But the case fatality rate that's being widely reported is around 2%. Is that bad or what? It's not good. To give you some comparison, a lot of people are saying the seasonal flu in the United States, for example, is much more frightening and should be much more frightening to people than the novel coronavirus, because in the United States, tens of thousands of people in an ordinary year die of influenza. This is absolutely true. But the case fatality rate for influenza in the United States is about 0.1%. So that's 1 per 1,000 people who gets infected with the influenza virus in the United States dies in a given year, roughly. What we're saying now is that 2% or 20 times as many people who get infected with coronavirus ultimately die. So if the case fatality rate really is 1% or 2%, it means that the coronavirus is 10 times or 20 times more deadly case by case than the flu is. There are a couple of other reasons why the coronavirus should potentially be taken more seriously than the flu. But if we want to know how many people will be affected, especially how many people will die, it's not just what's called the case fatality rate or the death rate, the number of people who die divided by the number of people who got infected. We also have to think about how many people get infected. So that has to do with how contagious the disease is and what percentage of the population gets infected. So if we take the United States, let's say the population of the United States is about 320 million people. So let's say 10% of the people in the United States were to get the coronavirus, and 1% of them were to die. So 10% of 320 million is 32 million, and 1% of that is 320,000. So 1% case fatality rate and 10% rate of infection would produce 320,000 deaths, which is obviously very frightening. But if the infection rate were 20% or 30% or 40%, which it sometimes is that high with seasonal influenza, then the number of deaths, even if the case fatality rate stays at 1% or 2%, if many, many more people get infected, then obviously many, many more people die. In addition to this, it's not just deaths we want to be worried about. Somewhere around 10 to 20% of the people who get infected, based on the early statistics from China, have a very serious illness, meaning they need to go to the intensive care unit. They need to have a tube stuck down their throat to be mechanically assisted in their breathing, and they may have serious damage done to their lungs. So it's not just the fatality rate, it's also this rate of serious cases, which, should it become more widespread outside of China, would begin to really challenge our health systems to deal with that many seriously sick people. Fact number 6. In many ways, it is more serious than the flu, and I want to give you a few reasons why. First, for the flu, there's a vaccine. For the coronavirus, there's no vaccine. Now, we all know the flu virus doesn't give complete and perfect protection. You can get the flu vaccine in a given year and still get the flu, though it's often less severe than had you not gotten the vaccine. But for the coronavirus, for the time being, there is no vaccine and probably won't be for at least a year. So that's one reason why coronavirus is more serious than the flu. That's one reason why the coronavirus is potentially more serious than the flu. The second reason the coronavirus is potentially more serious than the flu is that there are antiviral drugs that treat the flu, like oseltamivir or Tamiflu. They're not fantastic, but they do have some efficacy against the flu. There's no antiviral drugs, as far as we know, that are approved in the United States or elsewhere in the world that have any effectiveness against the coronavirus. So there's no vaccine and there's no effective antiviral drug, as far as we know yet. And as I've already said, the case fatality rate for coronavirus, if it's 1 or 2%, is either 10 or 20 times worse than the case fatality rate we see for the seasonal flu, which is about 0.1% or 0.2%. Fact number 7, there are steps you can take to take care of yourself and potentially protect yourself and your family. Though I have to admit, and that's why this is frightening, that none of these steps can guarantee that you or someone you care about or someone you love won't be infected and get seriously ill from this illness. But here are some steps that you can take, and you've probably heard about a lot of these on the news. You can wash your hands frequently. The most common way which we infect ourselves with viruses is by touching some surface that had the virus on it, and then touching our mouth, touching our nose, rubbing our eyes, and allowing the virus a pathway into our body. So wash your hands frequently. Don't touch your face. So wash your hands frequently. Don't touch your face. If you're sick, stay home to avoid infecting other people. If you want to wear a mask, if you're sick, it's a good idea to wear a mask. Surgical masks are actually better at keeping the viruses in and stopping you from spreading them than they are at keeping the virus out from the ambient air. So if you're sick, you could wear a mask so you don't infect your family, isolate yourself. Don't go to work if you're sick and you think you might have the flu or this disease from the novel coronavirus. Avoid people displaying obvious symptoms, so stay away from people who are sick. That's the way to avoid infection. Get a flu vaccine. It's not going to protect you from the novel coronavirus, but if you get a flu vaccine, you're less likely to get the flu and you're less likely to get a severe case of the flu. And in that way, you can do all of the rest of us a favor by not clogging up emergency rooms and taking up a hospital bed with the flu that someone with coronavirus or COVID-19 might need if the virus were to start spreading more widely in the community. So get a flu vaccine and keep yourself healthy during this potential period of an epidemic. Stop smoking. This is always good advice. It's the number one thing you can do to improve your health. And it's pretty clear that for people in Hubei province and in Wuhan city in China, that the disease appears to be more prevalent in smokers and has more serious consequences in smokers, or especially people with pre-existing lung disease and heart disease, which is common in smokers. So stop smoking. Help your vulnerable friends and family. The disease appears to be worse in older people, and it appears to be worse in people who have compromised immune systems or who have pre-existing chronic illnesses like heart disease, lung disease, diabetes, and other common chronic illnesses, which weaken you if you were to be affected by a severe pneumonia. If you have one of these chronic illnesses, you're going to be less able to fight off this severe pneumonia if you should get it. So help your vulnerable friends and family members. Now, it is the case that more than 760 million Chinese people are currently living under some more or less limited form of quarantine. So it's not inconceivable, since it's happening to 760 million people on the other side of the world, that it could potentially happen to us. Now, there's no reason right now to believe that we're going to be quarantined or that there's going to be social distancing measures like school closings, rapid transit closings, closings of movie theaters, and suspension of work. It's unlikely at this moment that those things could happen, but it's not beyond our imagination or considerations. It's actually happening to almost 1 billion people right now. So obviously it could happen to us, though it's relatively unlikely at this moment for it to happen to us. But one thing you could do to prepare is, what would you do if you were like a person in Wuhan who had to prepare to stay in their apartment for something like a 2-week quarantine? So you could stock up on essential medicines for your vulnerable friends and family, food, other things you need to get by for a few weeks if you were have to shelter in place at home to get through an epidemic if it were to start to spread in the community. Fact number 8, the areas of China that are affected most severely by the coronavirus are areas where vital basic ingredients for pharmaceutical drugs and vital components for medical devices are manufactured. So there are almost certainly going to be disruptions in the supply chain for vital pharmaceutical drugs and medical devices that will begin to cause shortages in the United States in the near term and for however long the situation in Wuhan and Hubei province in China lasts. So we need to prepare for some of these supply disruptions, and the FDA and other agencies are well aware of this and trying to take steps to find alternative sources of supply, but those can't always be found quickly. So some supply shortages in certain important drugs and medical devices can be expected. Fact number 9. The infection has spread to more than 25 other countries, and there is ongoing community transmission in many of those other countries, including Japan, Singapore, South Korea, and Taiwan, and Hong Kong. So this means community transmission means that not only just people who flew into those countries from China who already had the infection, but people already who hadn't gone to China, like people in Singapore who had no history of recent travel to China, who are getting the virus from other people in Singapore, or people in South Korea, or people in Germany even getting the virus from other people who have not traveled to China. So there's community transmission at a smaller scale than in China, for sure, a much smaller scale, but it is occurring in 5 or 6 or 8 other countries. So the virus has spread to like 25 or 26 countries, and there's ongoing community transmission at a small scale in many of these countries. Fact number 10. There are 15 confirmed cases as of the date of filming this video. There are 15 confirmed cases of novel coronavirus in the United States, but the number is likely to rise. There's likely to be community transmission in the United States, just as there has been in these other countries. So one of the main strategies against something like the novel coronavirus is what's called containment. You try to identify people who have the virus, then you try to isolate them and prevent them from infecting other people. And in that way, you can contain the virus. And this is the way that SARS in 2013 was contained and actually pretty much eradicated. They identified all the infected people, they traced all their contacts, they isolated them, and they stopped it from spreading. It's unlikely that containment is going to be successful in the United States and really around the world. There's enormous efforts being made to try to contain the virus by all these travel restrictions on people traveling to and from China, severe travel restrictions within China. But it's clear that these travel restrictions have not stopped the virus from getting into these 25 other countries and from beginning to spread, as I mentioned in the previous point, in many of these other countries, including countries with extremely good healthcare systems and very good infection control epidemiology, places like Singapore. It's still spreading in the community, though at a smaller scale. So another reason why containment is unlikely to work is that we now know that people who have no symptoms, no fever, no cough, etc., can be carrying the virus and can spread it to others. There's now evidence of this from these cases in Germany and from elsewhere. And also that the detection methods, travel or screening methods, appear to be ineffective because you can screen people for fever and stuff like that, but people have the virus and are contagious even when they don't have a fever or are showing any symptoms. And we have to remember that hundreds of thousands, if not millions of people traveled from China all over the world during the early weeks before the travel restrictions were put in place in China, including hundreds of thousands of people who entered the United States from China, or tens of thousands, I don't know the exact number, but large numbers of people who entered the United States and every other country around the world from China in the days and weeks before the travel restrictions were put in place. Some of those people are likely to have been infected. They are likely to be asymptomatic when they got to these other countries, and then they began spreading the virus there. So for that reason, containment is unlikely to be effective because our screening just can't be perfect. And people who got into the country but without symptoms and without being screened are likely in the community now spreading the infection. Fact number 11. There's reason to be skeptical about some of the official statistics coming out of China because of the history of censorship from the 2003 SARS epidemic, as I mentioned before. But now the infection is taking root in countries that have history of transparency and who have modern and advanced healthcare systems and infectious disease epidemiology, places like Taiwan and especially Singapore and Japan and South Korea. So we should learn from these countries, and we should get much more accurate data about the fatality rate, about how contagious the disease is, about what proportion of patients get severely ill, about how many people each infected person in turn infects. We should start to get much more reliable data from these other countries, although the numbers will be smaller than they are in China. 12. It's normal and okay to be frightened of something like this. It's frightening. It's an previously unknown virus, which is infecting tens of thousands of people and killing thousands of people, including otherwise young and healthy people. This is frightening. Just on its face, some unknown virus killing thousands of people, some of whom are otherwise healthy. So just the thought of this, and no effective drug and no vaccine. So of course that's frightening. And it's okay to be frightened. I'm a little bit scared. If you are, I think that's normal. And we shouldn't allow anyone to reassure us so much that we can't have a normal fear. And one normal response to fear is to try to do some preparation. Preparation helps us feel under control, and we can do some of the normal things that I talked about above to prepare to counteract some of our fear and anxiety. Number 13, there's reason for hope. First reason for hope is that over the past 5 or 6 days, China has been reporting decreasing rates in the number of new infections per day. I think it's almost a week now where every day the number of newly infected cases has been going down, which suggests, at least preliminarily, that the infection may be beginning to peak in China and they may be bringing it under control, which is good news for the rest of the world. So one cause for hope is that the apparent declining rate of new infections in China. A second reason to be hopeful is that there is a clinical trial underway in China testing an unapproved antiviral drug. I think it's called remdesivir. It was developed to treat Ebola, which is another viral illness, but it's never been approved in any market. So the FDA and so on haven't approved it as being safe and effective. But because of the extraordinary circumstances, there are 2 clinical trials going on in China right now testing whether remdesivir, this antiviral drug, is effective against coronavirus. And there should be results of those clinical trials as early as April. The third reason to be hopeful is that there is an unprecedented international scientific effort and public health effort to understand this virus and to bring it under control. The genetic sequence for this virus was published in such a short time, in early January, about a week after the epidemic became publicly known. Chinese researchers published the genetic sequence of this virus, allowing other people to develop tests, allowing scientists to begin developing vaccines. And now there are tens of thousands of scientists all over the world working extremely diligently to try to come up with drugs, vaccines, to try to identify existing drugs that might be effective against this virus, and even larger numbers of public health professionals trying to figure out how we do containment, tracking of infected cases, isolation, and so on. The fourth reason to be hopeful is that widespread community transmission of the virus is simply not occurring outside of China. As I've said, there is community transmission occurring in South Korea, in Japan, in Singapore, and etc. But it's not very widespread. The cases are in the tens of cases. I think even less than 100 cases in most of those countries. And there's only 15 in the United States. And we haven't seen community transmission as yet in the United States. As I said, I don't think this is a reason to be complacent or to assume it's never going to come. My personal belief is it probably will start spreading in the community, but it hasn't yet, and that's a reason to be hopeful. And finally, 14, and this isn't really a fact, it's just kind of a closing statement. New infectious diseases will always be with us. They are frightening, so it's okay to be frightened. We are going to get through this together. These new infectious diseases present a challenge to our political systems, and to our healthcare systems, and to many of our institutions. And if we don't have tremendous confidence in those institutions and systems, there's reason for us to be uncertain and anxious and frightened. And that's the way a lot of people feel about this virus. That's normal. But to get through something like this, I saw the president of Singapore give a great talk to his people about how they were going to get through this. And it had a lot to do with they're going to get through it together. So solidarity is so vital to us being able to get through a difficult situation like this if it gets much worse. Now, right now in the United States, where I'm making this video, the situation is not that serious. And the likelihood of being infected at this moment seems to be very low, with only 15 confirmed cases in a country of 320 million people. But the situation could get worse. And in some ways, it's likely to get worse. And if and when it does, we'll have to rely on one another to get through what could be a much more difficult time. So thanks for watching. If you like this kind of video, I don't make lots of videos exactly like this, but if you like videos about communication skills, come on over to HOWCOMMUNICATIONWORKS.CON, sign up for our email list, and we'll send you a free ebook. If you like this kind of video, hit like, share it with your friends who might be curious about what the coronavirus is. Thanks for spending some time with me. Hang in there. We're going to make it through this together.